Ocala's information station, 1370 WOCA.
Ocala.
All right, 5 minutes after 11 o'clock. Beautiful looking Thursday. Hey, it's Thursday. That means it's almost Friday. That means it's almost Saturday. See how my brain works? In the studio, Lauren Debick is here, and Lauren comes in with some really great guests from Ocala Health. She is the manager of marketing communications at Ocala Health, and today Lauren has brought in Dr. Andrew Shaw. Dr. Shaw is a board-certified neurosurgeon with Ocala Health Surgical Group. We're going to talk about back pain, and before we do that, though, let's just say good morning to Lauren, and he said I can call him Andrew, so I'll say good morning, Lauren and Andrew. Let me put your pictures on here. There you are. There you are. Oh, wow, look at two good-looking people, Robin. This is why the camera faces that way.
Exactly.
This is why the camera faces that way. Good morning, Lauren. How are you?
I'm doing well. How are you?
You're looking good as always. And Andrew, how are you?
I'm doing well.
What, you're uncomfortable with the title? How come?
Oh, I'm not.
Is it because I'm so much older?
No, it's because I'm young and my dad was Dr. Shaw, so it makes me feel out of place.
You're a doctor, though. You get our respect. It doesn't matter if we're older than you. Thank you for coming in today.
Thank you for having me.
So we're talking about back pain?
That's correct.
Specifically? Do we make mistakes with back pain? Do we think we know what we're doing, like having a child walk on our back and things like that?
Yeah, having a child walk on your back might be a little painful. You know, back pain is something...
But you've heard of people doing that, right?
In other countries, yeah. You know, back pain...
We're old. We lived in another country back then.
Yeah, we did another
I'm sorry, Andrew, go ahead.
No, you're fine. Back pain is such a challenge for healthcare professionals in general just because there's so many potential etiologies or places where it can come from.
Yeah,
you have muscles, you have bones that can come from, nerves. So there's so many potential locations that isolated back pain itself is a real challenge for a healthcare professional to treat.
I would think that, and I don't know much about what you're talking about, but I would think that if I had back pain and you told me it was muscles, that would be the best news because it's better than the spine. It's better than a kidney failure or something like that, right?
Yeah, definitely.
So,
yeah,
and kidneys feel just like a backache, don't they, when they go bad?
They can, for sure. It's important to have a whole team look at your entire body when you're seeking spine care or back care. Usually when it's more kidney problems, you have other symptoms radiating to your groin kind of thing. But we don't like to talk about groins, but
I don't mind talking about groins.
You need to.
When it comes to your back, some keys that you could think about is it there all the time? Does it come and go? Does it come only when you're standing up, walking around, or is it there when you're lying in bed? Because some of those things can give your healthcare practitioner some clues about what might be the potential source of it.
When you have the title neurosurgeon, that implies nerves, right?
Yes.
And they're all over our bodies. Yep. So is it sometimes, and I'm not I don't know anything about this, but we've had other people talk about referred pain. Could it be actually somewhere else? But it feels like it's your lower back. Is that possible?
So some organs could potentially cause some pain that radiates to your back, but if it originates from your back, there's not too many sources. So if you think of things like pancreatitis, sometimes you can have that radiating towards your back, and other medical conditions can radiate from one place to another. Usually what you see is leg pain. People don't always associate like leg pain with coming from your back.
Really?
Really?
Yeah, because when you hear pinched nerves, when you have a pinched nerve, that nerve originates from your back, goes down into your leg, and sometimes that pain that you're feeling in your leg is referred from a nerve being pinched in your back.
Can it be misdiagnosed then, the leg pain?
Usually there's some clues that suggest it's coming from your back, like a shooting kind of sensation, an aching, like a toothache kind of sensation can sometimes suggest it's from your back. If you have stubbed your toe, it's pretty obvious you probably stubbed your toe. But if it's something that's there all the time and is aching and your back aches, it kind of works hand in hand.
If somebody is listening and they're at the point where they need surgery, there's probably not a whole lot they can do except to wait for the surgeon to do his or her job, right?
So we always like to make sure that everyone gets conservative care before spine surgery or back surgery.
Okay.
Anytime you're going to have any surgery, we want to make sure that is the last resort.
Does that include chiropractic?
If that helps, sometimes with a lot of the musculoskeletal issues, chiropractic care can be beneficial.
Really? How about acupuncture? Does that make a difference?
Acupuncture has been shown to be very helpful for pain. If it's pain that's not from an organic cause, meaning a compressed nerve or a big disc herniation, that kind of thing, acupuncture can be very helpful. It can stimulate some of those peripheral nerves and redirect the pain. It changes the pain signals. It modulates how those pain signals are
It's
interpreted.
amazing how they figured that out, huh? And what thousands of years ago?
Thousands of years ago, yeah.
I mean, put a needle in.
Yeah.
Have you ever had acupuncture?
I have not had acupuncture.
Lauren, have you?
I have not, but I've had a machine that mimics it with the electricity, and it works, and it doesn't hurt. I was scared it was going to hurt, but it didn't.
Oh, really? Was it in your
Wow.
back or? I don't want to
The
get too
pain was
personal.
actually in my shoulder, and
Oh, really?
they did it on my ear, and I felt like the electricity move through, and
Wow.
I felt better.
That is pretty cool.
Wow, wonder how they knew where to put the needles. I saw.
There's some guy out there that looks like a pincushion. Is how they figure it out.
I've seen the pincushion guy. Yeah, we've had him in here. He was on the desk. He's only like 3 feet tall.
It's called voodoo, I think.
All right. So when Lauren mentioned her shoulder, I wanted to talk about that too because you have a large back. So far, I've been thinking of lower back, but
Your back's not large.
That's not what I meant. Thank you. Thank you. Yeah, I didn't mean your back was large. My back was large. But I was thinking, if you're upper, like when you help somebody move, you're carrying the refrigerator down the street.
Exactly.
This really happened last couple
It
weeks
did.
ago. It was so hard. Anyway, so at the end of the whole thing, it's like I'm out of breath, and it's like, oh gosh, my back is killing me now. But my upper back was killing me.
Yeah.
Yeah. Have you ever carried a refrigerator down the street?
I try not to lift too many refrigerators. Maybe boxes recently moving in.
Well, see, you have to lift the refrigerator out of the house onto the truck and then off of the truck into the next house. So the house was only a block away. I figured, well, we'll just roll it down the street. Should work. It did.
It was hard.
It did, but
worked.
it was really hard.
Does the refrigerator still work?
Yeah,
There you go. That's the key.
I hope. Doug, is that bologna still good? He listens.
You hear about people having their vertebrae fused together, and then you also hear about herniated discs. Are they does one happen when the other one happens, or are they two separate things?
Two separate things. When you think about spinal fusions, a lot of times we end up having to do that because of the amount of bone we have to remove. We destabilize the spine, and in order to restore stabilization, we have to put rods and screws in, which is called a fusion.
Oh.
So it's the main goal of surgery is to take the pressure off the nerves. So lots of things can cause pressure. The joints in your back can cause pressure on them. Some thickening of the ligaments that are there can cause pressure on the nerves, or even a herniated disc can cause pressure on the nerves. Sometimes in order to get the herniated disc out, you have to take off a lot of bone in order to get to it. And if that happens, then you need to stabilize the spine with a spinal fusion.
So if someone has a hernia, do they automatically have a herniated disc, or is that?
A hernia is more with your abdominal wall. A herniated disc, there's two things that people describe, a disc bulge and a herniated disc. So I like to describe like a disc bulge like having a jelly donut. You know how it looks like it's nice and thick when you're just looking at it, but if you press on it, it kind of squeezes out the sides.
Right.
Yeah.
Right.
And then if you push really hard, the jelly comes out. It's kind of like a disc. The center of the disc is more of a squishy kind of jelly component like the donut
Oh.
is. And when it comes out, it can push on nerves, and it's inflammatory, so the nerves hurt. So you have pain, and then you have that disc herniation. When it's a bulge, it's just from us having constant pressure on those disc spaces, and then the jelly donut compresses, and the donut squishes out a little bit.
Oh, okay.
So disc bulge doesn't necessarily mean a herniation, but sometimes they're used
I
synonymously.
am so getting a donut later on.
We were talking about donuts.
It's like the second time donuts have come up, right? In the last
Yeah.
10 minutes.
Like the sprinkled kind.
Oh, sprinkles are good.
We actually have a phone line open, so if we have any callers who want to ask questions about back pain, just ignore the fact that we're having fun with Dr. Shaw and with Lauren Debick. We need to take a little break, so we'll take that break right now. We've got another 15 minutes left in this interview, so we'll take that break and be right back. The number, if you want to call, is 622-9622. We'll be right back. This is The Source, WOCA.
The weather is brought to you by myfwc.com. Safe boating is no accident. Today is going to be sunny to partly cloudy. A thunderstorm will spread from near the coast this morning to inland for the afternoon. The high 91 to 95. Partly cloudy tonight, a low of 72 to 77. Sun and clouds tomorrow. Again, a thunderstorm inland for the afternoon hours. The high 91 to 95. Couple of afternoon thunderstorms inland Saturday. Otherwise partly sunny. High 91 to 94. From the Florida Weather Center, I'm meteorologist Maggie Johnson.
Are you in need of custom screen printing, embroidery, or promotional items? Then look no further and come visit the brand new Legacy Team Sales. LTS is conveniently located off 17th Street next to Armstrong Homes in beautiful Ocala. We offer the best prices and highest quality products for your company, team, school, or nonprofit. Whether looking for screen printed shirts, embroidered polos, or travel team uniforms, you'll be sure to find it at Legacy Team Sales. Come visit our new 27,000 square foot facility. Our friendly and knowledgeable sales staff will assist you in every part of your custom purchase. LTS carries the hottest brands in the industry like Under Armour, Russell, Mizuno, Asics, Badger Sports, Gildan, Pacific, Ogio, and many more. At LTS, screen printing embroidery is done in-house and we guarantee customer satisfaction. Stop by, give us a call, or check us out on the web at shoplts.com. Remember the name, LTS.
Say that this country is in the toilet. Some would even go so far as to say the economy is going down the drain. But we say, if water runs through it, we do it.
Hi, I'm Sean Scott, owner of Mike Scott Plumbing, and I approve this message.
Veterans are the foundation upon which our freedom is built. Listen to The Source, WOCA, each Thursday at 9 a.m. to Veterans News with Hank Whittier from Vets Helping Vets. You'll hear tributes, information on veterans issues, and stories that will make you laugh, cry, and feel proud. Veterans News always focuses on the military, past and present, and on our first responders. Veterans News is brought to you each week by Bob Wine's Camellia Gardens and Nursery, keeping you blooming since 1952.
Hi, this is Mayor Kent Gwynn. Have you ever wondered what the younger generation thinks? Well, here's the chance to find out. The Mayor and the Millennials coming soon to WOCA 1370 AM, 96.3 FM, The Source.
WWWWOCA, WWWWOCA.
1370 WOCA.
All right, 17 minutes after 11 o'clock, and you want to know what the temperature is, right? Everybody always wants to know the temperature. And the heat index, by the way. The temperature is 90. The heat index is 102. It's expected to climb to 96 now, and the actual temperature, the heat index, 111. We'll see if we get to that. That's what it feels like. It doesn't do that in L.A. There's no humidity in L.A. Dr. Andrew Shaw is from L.A. by way of Ohio, now living in Ocala, and this is brand new for you. And we're talking to Dr. Shaw about back pain. Dr. Shaw is the guest of Lauren Debick, who brings us some great guests from Ocala Health on a regular basis. And Dr. Shaw is a board-certified neurosurgeon. Is there any such thing as he's a neurosurgeon, but he's not board-certified? I wouldn't want that guy.
Well, it's funny you bring that up. Technically, when you're done training, you're board eligible.
Okay.
So board certification takes 2 years to complete.
Oh, my.
You'd have to collect cases for a year, and then you have to have 6 months of follow-up, and then you sit for your boards after that. So it takes about 2 years to get board certification.
You don't even look old enough to have all that behind you.
Well, I'm technically board eligible at this point.
Okay, board eligible.
Yeah, eligible. I've taken half my boards. I've taken the written portion of our boards, but then we have an oral portion of our boards where they get us in a room and two guys sit there and stare at you and ask you questions.
Oh, that's got to be nerve-wracking.
They can't ask him without staring? I mean, wouldn't that be nice just to ask? The staring would drive me nuts.
Yeah.
So you went to Ohio because of school. Yeah. What made you come to Ocala?
We loved it when we interviewed down here. It was beautiful.
Oh, is that right?
It's funny. My daughter and I were actually in Orlando going to Disney World, and she was 6 a couple years ago, and we were sitting on the monorail going from the terminal baggage claim, and she's like, "I want to live here." And I'm like, Yeah.
But she meant Disney World. She meant.
Yeah.
She just liked the palm trees. She's like, I want to live here. And I'm like,
That is the one. Yeah, that me too. And when I first came here, it was the palm trees.
Yeah.
But I was so disappointed. No coconuts, weren't
yeah, no coconuts.
Yeah, you have to go a little further south for them.
Yeah.
I didn't know.
And neither did I. But a 6-year-old pretty much determined where I was going to live. Living in Florida. It's beautiful here.
So did you have a lot of stuff to move? I'll try to get back to back pain with this question. Watch this.
Yeah, we had enough to fill a truck.
Did you do it yourself or did you hire people?
Oh, no, we hired people. I've moved myself enough in life.
Oh, yeah.
I lifted a
that's true.
refrigerator once. It was we
it's
broke it
horrible.
though. It
Did you really?
It didn't
That's
turn
why
on.
you asked the question.
Yeah, it didn't turn on ever again.
Refrigerators, pianos, and convertible couches are the 3 worst things to move.
Yeah.
Never tried moving a convertible couch. That seems heavy.
They're
You
horrible.
got to make sure you strap it because if you're pulling it down the steps, it'll just like
They fall apart. They're heavy. It's unbelievable.
When
And if you move a waterbed, get the water out first.
when people go in for hip replacements or knee surgery, can that affect their back and give them back pain?
Sometimes it's interesting. Hip pain can be masqueraded as back pain. So people will sometimes think that they're having terrible back pain. In fact, it's originating from their hip. So a lot of times we work with orthopedists in order to figure that out. There's different provocatory tests that you can use to figure out whether it's coming from someone's hip or from someone's back.
It's an interesting word, a provocatory test. Have you ever had
I
one?
don't know if that's in the dictionary, but
It is now. You invented it.
So, do you have patients who come to you who basically have lifestyles that just need to change? Like, I'm guessing some sports might cause backaches, and do you just say, you know what, that bowling is really doing it? You got to stop that.
proper body mechanics is probably the most important thing.
Just
if you
doing it
lift
right.
with your legs, if you're doing it right.
Yeah.
The more bending and twisting you do, it's harder on your back. So people who play golf, which is probably quite a few people in town, it's hard on your
They
back because
do.
you're doing this bending, twisting. Just think of Tiger Woods. He was a young, healthy athlete, and his back's in terrible shape because it's really just hard on your back.
And how about those big black belts that we see people wear, like when they're working warehouses and stuff like that? Is that good or is that not a good idea?
It's okay to wear back braces when you're lifting, but if you wore it all the time, it can weaken those muscles that help support your spine.
Oh, really?
Your abdominal muscles and your paraspinal muscles are incredibly important to support your spine.
When we hear of serious back, like spinal things, like Robin mentioned before, the fusion things, right? Is there something in the future, maybe with stem cells or something, that will replace that? Is there something on the horizon?
Stem cells exist right now just to help with fusion. So when you talk about fusion,
Oh,
we put
really?
the rods and screws, but we actually are dependent on your bones healing together. And so we currently have many stem cell options from a variety of companies that are supposed to help promote fusion.
Do you see still a lot of children that have spina bifida now, or is that like under control where there are hardly any children that get that?
It was amazing. One of the biggest thing that neurosurgeons did for all the communities across the globe was introduce folic acid, or bring up the idea that folic acid is incredibly important in your diet in order to prevent spina bifida. It does still occur. The incidence is much lower than it ever was, but we see it predominantly at children's hospitals just because those babies get shipped to the variety of specialized hospitals in order for them to get the appropriate care by pediatric neurosurgeons.
Are your patients referred to by other doctors, or do they go directly to you?
Usually they're referred from another physician. Someone says, my back hurts, they get a picture, an x-ray or CAT scan or MRI or something, and then they get referred to us.
And are you going to open your office August the 1st?
August the 1st.
And where is that going to be?
That's a good question. It's, where is our office? I have a business card somewhere.
Oh, okay.
It should be on the website for Ocala Regional.
Lauren, did we go through Ocala Health?
Yes, absolutely. So you can call our health hotline if you would like a physician referral, and the number for that is 1-800-530-1188. And the number for Dr. Andrew Shaw's specific office is 352-629-1743.
Did you want to squeeze in the information? Because I don't want to rush you at the end. You had some other information?
Yeah, absolutely. So just to give a quick overview of our program, it's a very comprehensive program. There's actually a special unit dedicated to neurosurgery. We have certified nurses, physicians, and licensed dietitians who all provide comprehensive and multidisciplinary care. What we also offer are pre- and post-education classes for this. So you have the opportunity to come in, get all of your questions answered, and get all of that information. And if you also want any information about those classes, you can call our health hotline.
Oh, that's wonderful.
Right, excellent. Do you have, you know how when a lady goes in and has a baby, and they used to have them in the hospital for a whole week, now they get up and start walking around right away. Is that applied to surgery in general and back surgery specifically?
Yeah, well, I love when patients get up. That's when the number one thing that we stress when you're in the office. I learned from a guy from Lower Alabama, an orthopedic surgeon. He used to call it the back coma. If you don't get up out of bed, your back goes into a coma.
Really?
It's important to get out of bed. The sooner you get out of bed, the sooner you get out of the hospital, the sooner your muscles start feeling better, and the sooner you're back to normal life. So we're very pro getting people up. We have physical therapists that work extensively with patients to help get them up and mobilize them right after surgery. And it avoids some of the medical complications like blood clots in your legs, urinary tract infections, that kind of thing.
Really?
Oh, my gosh.
So walk and drink water and all the other eat good things with folic acid in them. And
yeah, exactly.
Does the age of the patient, I'm guessing it's a dumb question in actuality, but the age of the patient must matter then, right?
It doesn't matter, every age.
Really?
We want to get you up and moving.
Okay. Well, what I mean is, does a younger patient who has had back surgery heal or recuperate quicker than an older patient would?
Not necessarily.
Really?
It's really individual. We've had some young people that take much longer than some of our older individuals to get up and move around and be active and return to normal life. So it just depends on the individual.
And
as long as you're motivated and you are willing to get up and walk around, you'll get better quicker.
And for women that do become pregnant, is there something now where the doctors keep an eye on their spine to make sure there's not undue pressure on it, or it stays the direction it's supposed to stay?
For pregnancy, we like to avoid any kind of spine surgery. So even if you have a spine problem, we usually like to wait until you've delivered, and then we see you after the fact. Because sometimes all your ligaments and muscles relax and get stretched, and you have pain and things that might not be present after the baby's delivered. So we usually defer any sort of spine surgery till after any form of pregnancy.
Dr. Andrew Shaw is who you're listening to. He's board eligible, thank you, neurosurgeon with Ocala Health Surgical Group. And Lauren Debick is here. She has invited Dr. Shaw to talk about back surgery and back pain in general. What does it look like when you're doing surgery? Is the patient lying on his or her belly? Are you cutting into them? Is there what do you call laparoscopic? How do you do it?
So there's a variety of ways to do spine surgery. We usually have special tables, and it lets your belly hang free so you don't have a lot of pressure on your abdomen. But yes, we do make skin incisions.
Funny underneath,
yeah, we do make skin incisions. We move the muscle.
Can we get a picture of that underneath? Look at this. Look at that belly.
We for any sort of surgery, to get to the bone, we have to move the muscle off it, and then we're looking at your bones. And depending on what we need to do, we can put rods and screws in. We can take pressure off nerves. That kind of thing.
So you're literally cutting into it. You're opening it up like a steak.
Well, there's all sorts of different ways to do it. Sometimes you peel the muscle off the bone. Sometimes you split the muscle with minimally invasive retractors. These tubes and retractor systems that they've made.
Now, how about athletes? Do they have spine surgeries or back pain or anything like that? Or is it because they're training so much that they're immune to having something go wrong?
Oh, no, they definitely, we see them all the time. Back strains are pretty common. Musculoskeletal strains are pretty common, but they also have the same problems that any of us do, just from wear and tear on your back. A lot of times it's neck problems, like Peyton Manning, how he herniated the discs in his neck. A lot of times it's from football players get a lot of repetitive hits and their heads get whipped back. They get degenerative changes in their necks. And the same thing happens in their lower back. A lot of times they're young though, so you don't see them until they're older on.
So will your practice encompass the university? I mean, will you get patients from up there? Because obviously there's a lot of athletes up there at the university.
I'd be happy if they'd like to come down and visit me.
Well, sometimes they do, right? They come down here before the games, I think, to get away from the nightlife or something because it's so dull here. No, I'm just...
No, they have swimming. They have sunshine.
Is that why they come to Ocala?
Yes.
Oh, okay.
I thought it was for the horses.
Yeah, that's what it's for. It's for the horses.
And when you introduce yourself to your new patients, what do you do to make them trust you?
Well, I think you just start building a relationship. You listen to their problem. You try to understand where they're coming from, what their main issue is, what they want addressed, and you walk along with them.
It's part of what this does. When Lauren brings you in here, we do the video. Sometimes people will meet you for the first time because they've watched the video and they say, "Oh my gosh, that's my doctor right there." And it is trust. That's the only thing we really can offer other than information.
Exactly.
It's a way for people to, because you can see right through the radio.
Yeah, you can.
Especially when there's a video. Well, thank you for coming in, Doctor. Welcome to Ocala.
Thank you so much.
This was fun. You're a good-looking guy, and God bless you and your family, and enjoy your visit here. And Lauren, you are a delight as always. Do you want to leave with any phone numbers?
Yes, absolutely. So our health hotline number again is 1-800-530-1188 for any questions or more information about any of the services offered by Ocala Health.
You guys are great. Thank you for what you do.
Thank you for having us.
Thank you for coming. We will be right back. Fun with Joe is up next, including Out of Left Field.
There you go.
Fox News Radio, I'm Lillian Wu. Ted Cruz standing by his refusal to support Donald Trump, which got him booed at the Republican convention last night, admitting while he did make a pledge.
The day that was abrogated was the day this became personal, and as I said at the time, and I'm not going to get into criticizing or attacking Donald Trump, but I'll just give you this response. I am not in the habit of supporting people who attack my wife and attack my father.
Speaking to the Texas delegation this morning, telling them that people deserve leaders who will do what